Hi, everyone. Welcome to the Child Anxiety FAQ podcast. FAQ stands for Frequently Asked Questions, and I'm answering my listeners' questions about child and teen anxiety. My name is Dawn Friedman, and I've been working with kids and families for more than 30 years as a preschool teacher, parent educator, family case manager, clinical counselor, and now as the owner and operator of Child Anxiety Support, where I help parents of anxious kids. And this episode's question is, what do I do if I've pushed my anxious child too far? This, as usual, is a very basic question that comes from a larger discussion I was having with someone about their child who they were trying to get to do a thing. As you know, I don't give out information about the actual details about the families that I've worked with. So this is very general. I make them up. I usually call the kid Joan because I haven't worked with anybody who has a kid named Joan. So this time, our imaginary person, Joan, is, I'm kind of going to make up the scenario so that it mirrors the scenario, but does not actually highlight any identifying details. So let's say that Joan is 10 and Joan is having some school refusal and struggles to get out the door in the morning. This is a pretty common scenario. And Joan's school refusal is less like, I'm not going to school. It's more about checking, about having to really fuss about an outfit, really worrying about what she's having for lunch, how she's packing her backpack, checking on her homework. Basically, Joan's school refusal looks like dragging her feet. Maybe that's familiar to you. Maybe you didn't realize that that's a little bit of school refusal, that not always, but sometimes that foot dragging, that trying to get out the door, the tears in the morning, maybe that the child's anxiety is rising up as they're facing their anxiety about going to school. And this morning, Joan's parent just kind of lost it with Joan, and they had a big blow up, and Joan was in tears, and she had to drag Joan into the school in tears. And basically, this parent is feeling like maybe I'm too hard on Joan. Maybe I am pushing her too much. Yeah, it's a common struggle for parents. And this is what I see happen often when we've got an anxious child who has a lot of these behaviors, a lot of these drag on their feet behaviors. And the parent is really, really patient and really, really patient up to a point, and then the parent loses it. And then they come to me and say, I'm really harming my child. What am I doing wrong? I'm making it so difficult. I really think that they are not able to do this, and I am pushing and that's not helping. And you're saying go towards the anxiety, but when that happens, all hell breaks loose. All right, deep breath, Joan's mom. Again, this is a really common scenario. And ironically, it's not the pushing that was the issue. It was not Joan's parents' meltdown that was the issue so much as that when we dug into it and really looked at that morning routine, what we saw was a ton of parenting pitfalls. Without realizing it, Joan's family had all of these kinds of structures put in place that the family was doing to try to get Joan out the door. There were all these kinds of tricks and tips that they were doing. And as we really, really looked at it, these were things that were happening even the night before. In fact, even the day before when Joan first got home from school. Basically, Joan's anxiety was ruling everything in the family. And the family was completely squished into this tiny little limiting box trying to manage Joan's anxiety, which started the minute that they got her from the bus stop. Joan came home from school and was already fussing and fretting about school. And then there was the drag about homework. And then there was the getting ready for bed because Joan was already worrying about the next day at school. And then there was this setting out the clean clothes for the next day at school. And then there's waking Joan up and she doesn't want to get out of bed. And then it was dragging her through the morning routine that was getting more and more complicated because Joan was so sensitive that if people didn't communicate with her in the just right way, their whole morning routine got derailed. And all of a sudden, no wonder Joan's parent is yelling at Joan because Joan is still not out the door and they're going to be late for school again, or the parents are going to be late for work, or all of the above. It's not just the morning routine. That's kind of where the parents were focused. We need to fix the morning routine. But the morning routine starts the day before. The morning routine starts with understanding all of the ways the family is trapped in the parenting pitfalls of child anxiety so that they can start identifying where they can pull back. It's about changing the way the family is doing things overall in order to set up an environment where they really can be helping Joan go towards the thing that scares her. When we're focused on the one particular time where there's really a lot of conflict, we might be missing a whole lot of information that's important to know. For some kids, the morning is it. The morning is where we're going to really work on the intervention. But for other kids, it is going to be the night before because maybe Joan isn't sleeping well. And maybe we really need to make sure that she's getting a more or less good night's sleep before we're asking her to be lovely in the morning. Maybe we need to be looking at the way the school is handling things and asking them to make some kind of difference as we work towards getting Joan out of the door. Maybe there needs to be a more collaborative plan in place. Maybe Joan is actually able to do more, but the parents are really struggling with their idea of how Joan is, which is to say, maybe Joan is just a super whiny kid, and the parents feel like the whining means they're pushing her when actually Joan is just whiny. Maybe once they realize Joan is just whiny, but is still able to go towards her anxiety, the parents don't get as frustrated with the whining, or they come up with a plan like wearing those loop earphones is a really good idea if you have a kid who is whiny and it's hard to hear the whine. So we're going to look at all of it. We're going to look at the family's entire functioning. We are not going to start with the assumption that Joan is being pushed too hard. We're going to be open to that, but we're going to look at everything because that might not be exactly what's going on. Before we take any action, we're going to get the lay of the land. You know what's interesting about that is sometimes in the process of getting the lay of the land, in the process of stepping back and looking at what else is going on, the parents realize all this for themselves and they're not really needing my eyes on it. As we dig through it, they say, oh, I see we could do this. Maybe if we did this, it might be a little bit different. And sometimes doing one thing differently impacts a whole lot of other things. Other times, the parents say, okay, we see it, but we don't know what to do. We don't know where to start. There are so many places we could be doing things differently. How do we start? And then I help them figure that out with the understanding that when we work in that area, we might see change in these others. And again, we might not. But we're going to start untangling the complex knot of how child anxiety really has a grip on that family. I want you to know too that when it comes to the parenting pitfalls, you are much more likely to get trapped in them if you have a child who is intense or if you yourself are intense. If you have a child with big emotions, strong emotions, it's going to be easier for you to get trapped. And if you are someone with big emotions, strong emotions, feels things deeply, lots of empathy for your kid, you are also more likely to get trapped in the parenting pitfalls of child anxiety. And that's just good to know. Those qualities, that intensity that you have, the intensity your child has, those are in and of itself not bad qualities. And in many ways are wonderful gifts, especially for you, because that connection and that intensity that you feel, we really can use that to bring to bear to the work of untrapping your family. But your child, those are gifts for them too. It might make things more challenging. As a matter of fact, I'd say 100%. It's going to make things more challenging, But we're just going to know that. We're just going to accept that, hey, we're going to have it a little more difficult. I know that won't surprise you. Intense kids are a little more difficult, and the payoff is going to be worth it. If you have a question about child anxiety that you would like me to answer on the show, please go to my website, childanxietysupport.com, and you can go up in the menu. It says podcast, click there, and there's a form to submit your question. Maybe I'll answer it on the next episode. Thanks.